My name is William Lewis. I'm the chair of the clinical work group of the Get With the Guidelines Atrial Fibrillation Project.
I'm Michael Gold, and I'm currently the president of the Heart Rhythm Society. The Heart Rhythm Society decided to partner with American Heart Association on the Get With the Guidelines AFib program because there clearly is a need. Atrial fibrillation is the largest, most common arrhythmia that we see in clinical practice. It's growing very rapidly as the patient population ages and other risk factors continue to increase.
And when we had a program that involved atrial fibrillation, we felt it was very important to collaborate and partner with that organization.
There's a clear gap in our understanding of how to optimally treat these patients and a clear need for improving our treatment of these patients.
Get With the Guidelines AFib is a national quality improvement program by the American Heart Association, which has been shown to improve adherence to guidelines in atrial fibrillation. Now we know that outcomes improve when adherence to guidelines increases. And so thus the real goal of Get With the Guidelines AFib is to prevent the consequences of atrial fibrillation like stroke, heart failure, and death.
Hospitals benefit as we've had programs for education, for best practices for hospitals, and ultimately we think patients benefit both from the education that we provide directly to patients as well as improving procedures as well as hospital care and identification of best treatment.
We know that these guidelines save lives, and therefore if we can improve the adherence to guidelines, patients in the end are the winners. They are going to see fewer episodes of stroke, less heart failure, fewer deaths, and a better patient experience. We also will be able to collaborate on the database to do really great research that can actually improve outcomes for patients nationwide as well.
One of the really unique aspects of a registry like this is that it's not a closed system where we're going to decide what information gets disseminated. Each hospital can decide what information they need. We believe that the strategy being adopted of this open platform of individualization of data is going to advance patient care tremendously because this will allow us to have hospitals do internal validation of their approaches. It's going to be so helpful to just have more information so that there'll be less indecision that occurs on almost a daily basis.
Working with the Heart Rhythm Society is a great benefit to the American Heart Association. When both of these organizations work together, we will be able to reach more patients and refine the program to make it better than it is currently.
The best thing of working with the American Heart Association is that it's a first-class organization, and I strongly believe that Heart Rhythm Society is also a first-class organization, and we can work together in the absence of egos to do what's best. We can take advantage of each other's skills, and with the common goal of trying to create the best product we can and create the best way that we can care for our patients.
And there is nothing more personal than having a discussion with a patient about how their treatment for atrial fibrillation is going to progress.
If you're a cardiologist, you don't go through a day or two without atrial fibrillation. If you're an electrophysiologist, you don't go through an hour or two without being impacted by atrial fibrillation.
A large number of patients, when we think about giving them a blood thinner, the discussion is over the risks and benefits of doing that. And that's where guideline adherence is really important. And that's where the Get With the Guidelines program helps us, because it gives us a framework in which to discuss with that patient, that individual patient, what their best outcome can be. And that's the benefit of this program.